By now, you've learned how to provide compressions and give breaths with and without a mask. Let's look more closely at using an AED. Even though you may be in the midst of providing CPR, once the AED arrives, use it immediately. Let's go back to our scene with Gene and Anthony. We'll pick up just before the AED arrives.
28, 29, 30.
I got the AED, but I don't know how to use it.
I got it.
I don't know if I can answer all of your questions, so I'm going to put you on speaker mode and put the phone next to the man who's helping him. This is the dispatcher.
Can you hear me? We have an AED. I'm attaching pads now.
Yes, I can hear you.
Plug in pads connector. Analyzing heart rhythm. Do not touch the patient.
Everybody stay clear. Don't touch him.
Shock advised. Charging. Stay clear of patient.
Everybody stay clear.
Deliver shock now. Shock delivered. Begin CPR. Start with compressions.
CPR combined with using an AED provides the best chance of saving a life. If possible, use an AED every time you provide CPR. When sudden cardiac arrest develops, the heart quivers and stops pumping blood. A shock from an AED stuns the heart so that the heart's rhythm can reset and the heart can pump blood again. To use an AED, you simply turn it on by either pushing the on button or lifting the lid. Once you turn on the AED, you will hear prompts telling you everything you need to do. AEDs may have adult and child pads. Make sure you use the adult pads on anyone 8 years of age or older. Peel away the backing from the pads, following the pictures found on the pads. Attach the adhesive pads to the person's bare chest. If the AED recommends a shock, it will tell you to stay clear of the person. If the AED tells you to clear the person, then loudly state, "Clear." Look to be sure no one is touching the person just before you push the shock button. As soon as the AED gives the shock, immediately resume chest compressions. Following this demonstration, you will have a chance to practice using an AED trainer, just so you can see what it's like. You'll start with your hands in place to give compressions, and the AED will arrive immediately. First, turn on the AED by pushing the on button or opening the lid.
Attach pads to patient's bare chest.
Follow the AED prompts and the pictures on the package or pads.
Plug in pads connector. Analyzing heart rhythm. Do not touch the patient.
Okay, everyone stay clear.
Shock advised. Charging. Stay clear of patient.
Okay, everyone clear.
Deliver shock now. Shock delivered. Begin CPR. Start with compressions.
You'll need to consider a few special situations when using an AED. First, if the victim has hair on his chest, the hair may prevent the pads from sticking. If your AED has only one set of pads, a razor should be included. You can use the razor to quickly shave the area and then apply the pads. If your AED has 2 sets of adult pads, you can apply 1 set to the hairy chest. If the hair prevents the pads from coming in contact with the chest, the AED should tell you to check the pads. If it does, press the pads down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then reapply a new set of pads to the bare skin. Water on a victim's chest can also be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the victim's heart. If someone is lying in water, you should quickly move the victim to a dry area. However, if the victim is lying on snow or in a small puddle, you may use the AED. And if the chest is covered with water or sweat, wipe the chest before attaching the AED pads, but wipe the chest quickly. It doesn't have to be completely dry. Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pads. These devices look like a round or square lump smaller than a deck of cards. If you see this lump, avoid putting the pads directly over it. Also, do not place the pad directly over a medicine patch. If a medicine patch is located where you need to place a pad, take the patch off and quickly wipe the chest before you put on the pad. If your workplace has an AED, you should familiarize yourself with that AED. Regardless of the type of AED, remember to turn it on first and follow the audible prompts that will lead you through the rest of the steps. Additional emergency equipment may also be found in the AED, such as scissors, razors, wipes, gloves, and a barrier device. These items may also be found in a separate emergency or first aid kit. AEDs can be used for children and for infants too. Many AEDs have pads for adults and a child pad cable system or a key. But if there are no child pads, or if there isn't a child key or switch, use the adult pads. Also, if the child is 8 years of age or older, use adult pads. We have more information on providing CPR and use of an AED for children and separate menu options on this video. The DVD will now pause for you to practice with an AED trainer. And don't worry, it can't really give a shock.